The term managed care is used to describe a variety of techniques intended to reduce the cost of health benefits and improve the quality of care. It is also used to describe organizations that use these techniques. Managed care organization. Many of these techniques were pioneered by HMOs, but they are now used in a wide variety of private health insurance programs. Through the 1990s, managed care grew from about 25% US employees with employees to offer federally certified HMO optional, unlikely traditional indemnity insurance, and the HMOs covers only care rendered by those doctors and other professionals who have agreed to treat patients in accordance with the HMOs guidelines and restrictions in exchange for a steady stream of customers. Benefits are provided through a network of providers. Providers may be employee of the HMO staff model, employees of a provider group that has contracted with the HMO group model, or member of an independent practice associations. HMOs may also use as a combination. Medicare. In many states or regions, the United States and provided coverage to state government employees as well as to federal government employees under a nationwide option of the Federal Employees Health Benefit Plan. Health Maintenance Organization. A health maintenance organization is a type of managed care organization MCO that provide a form of health care coverage that is fulfilled through hospitals, doctors and other providers with which the HMO has a contract. The Health Maintained Organization Act of 1973 required employers with 25 or more employees to offer federal certified HMO options unlike traditional indemnity insurance, and HMO covers only care rendered by those doctors and other professionals who have agreed to treat patients in accordance with the HMOs guidelines and restrictions in exchange for a steady stream of customers. Benefits are provided through a network of providers. Providers may be employee of the HMO, employees of a provider group that has contracted with the HMO, or member of independence IPA. HMO is also a combination. Blue Cross Blue Shield Associations. The Blue Cross Blue Shield Associations BCBSA is a federalization of 38 separate health insurance organizations and companies in the United States. Combined, they directly or indirectly provide health insurance to over 100 million Americans. BCBSA insurance companies and franchisee, independent of the associations, and traditionally each other offering insurance plan with defined reasons under one or both of the association's brands. Blue Cross Blue Shield associations in every US state, insurance covered in every US state, and also act as the administration of relationship between the patient and the medical provider was not changed. The patient received medical care and was responsible for paying the provider. If the service was covered by the policy, the insurance company was responsible for reimbursing or indemnifying the patient based on the provision of the insurance contract. Health insurance plans that are not based on a network of contract providers or that base payment of a percentage of provider charges are still described as indemnity or fee for the plans. Sharing provisions. While self-employed individuals receive a tax deduction for their health insurance and can buy health insurance with additional tax benefits, most consumers in the individual market do not receive any tax benefit. Type of medical insurance: traditional, amenity or free for service. Early hospital and medical plans offered by insurance companies paid either a fixed amount for specific disease or medical procedure, scheduled benefits, or a percentage of the provider fees. Individual purchased. Prior to the ACA effective in 2014, the individual market was often subject to medical underwriting, which made it difficult for individuals with the pre-existing conditions to purchase insurance. The ACA prohibited medical underwriting in the individual market for health insurance marketplace plan. Prior to the ACA as of 2007, about 9% of the Americans were covered under health insurance purchased directly, with average out-of-pocket spending is higher in individual market with higher deductibles, co-payments and other costs. Providers network can be used to reduce cost by negotiating favorable fee from provider, selecting cost-effective provider and creating financial incentive for providers to practice more efficiently. A survey issued in 2009 by America's Health Insurance Plan AHIP found that patients going to out-of-network providers are sometimes charged extremely high fees. Network-based plan may be either closed or open. With a closed network, enrollees' expenses are generally only covered only when they go to network providers. Only limited services are covered outside the network, typically network-based managed care. Many managed care programs are based on a panel or network of contracted healthcare providers. Such programs typically include a set of selected providers that furnish a comprehensive array of healthcare services to enrollees. Expert standard for selecting providers. Formal utilization review and quality improvement programs. An emphasis on preventive care and financial incentive to encourage enrollees to use care efficiently. Only emergency and out-of-area care. Most traditional HMOs were closed network plan. Open network plan provides some coverage when an enrollee used non-network providers, generally at a lower benefit level, to encourage the use of network providers. Most preferred provided organization plans are open network, those that are not often described as exclusive provider organization or EPOS, as are point of services POS plan. The term open panel and closed panel are sometimes used to describe which healthcare providers in a community have the opportunity to participate in a plan. In a closed panel HMO, the network provider are either HMO employee or member of large group practices with which the HMO has a contract. In an open panel plan, the HMO or PPO contract with independent practitioners, opening participating in the network to any provider in the community that meets the plan credential requirements and is willing to accept the term of the plan's contract. Other managed care techniques. Other managed care techniques include such element as disease management companies. However, some Blue Cross and Blue Shield plan continue to serve as insurers of last resort. Similarly, the benefit offered by Blue plans, commercially insured and HMOs are converging in many respects because of market pressures. One example is the convergence of preferred provided organization PPO plan offered by Blues and commercial insurers and the point of services plan offered by HMOs. Historically, commercial insurers, Blue Cross and Blue Shield plans and HMOs might be subject to a different regulatory oversight in a state. Example, Department of Insurance for insurance companies. Tax preferenced healthcare spending account. Coupled with high deductible plan are various tax advantages. Saving plans funds such as salary can be placed in a saving plan and then go to pay out-of-pocket expenses. This approach to addressing increasing premiums is dubbed consumer driving healthcare and received a boost in 2003 when President George Washington Bush signed into a law Medicare Prescriptions Drug Improvement and Modernization Act. The law created tax deductibility, health saving account, untaxed private banks account for medical expenses, which 1.2 dollar for individual and 2,400 US dollar for families. HSA enable healthier individuals to pay less for insurance and deposit money for their own future healthcare, dental and vision expenses. HSA are one form of tax-preferred healthcare spending accounts. Other include flexible spending accounts, Archer medical saving accounts, which have been suppressed by the new HSA, although existing MSA are grandfathered, and health reimbursement account. These accounts are more commonly used as a part of employee health, which can be established by those who can already have health insurance. Withdrawal from HSAs are not penalized if the money is spent on non-medical items or services. Fund can be used to pay as qualified expenses, including doctor fee, Medicare Parts A and B and drugs without being taxed. Consumers wishing to deposit pre-tax fund in an HSA must be enrolled in a high deductible insurance plan with a number of restrictions on benefit design. In 2007, qualifying plans must have a minimum deductible of US dollar of 1,050. Consumers overtake it.